Hi, I'm Eugenia Gianos, Director of the Women's Cardiovascular Center at Lenox Hill Hospital and Director of Cardiovascular Prevention at Northwell Health. I've participated as faculty for several CVI CME programs, and I thank you for viewing this CVI Heartbites segment. You'll notice this CVI program is a bit different than others you may have seen. There is no structured PowerPoint presentation, but several really important messages. I'm here to share with you the story of my dear friend, Dr. Lorna Breen. I want you all to know what an amazing person she was. She was my senior resident in training and a true role model, someone who was tough and could handle any emergency situation, yet patient, understanding, and took the time to teach all of us. She was successful in her career as an ER director, and yet more than that, she was a true friend to her New York family. She was adventurous, fun, caring, compassionate, and quirky. And most importantly, she was very much like the rest of us. For this reason, I think it's really important for all of us to talk about the realities that I've highlighted in an editorial piece I wrote for MedPage Today, titled, "First, Do Thyself No Harm." I've provided the link and I encourage you to read it and share it with your colleagues at your institution and beyond. There are several important things to remember as we deal with the effects of COVID-19. First, to the surprise of many of us in the setting of extreme circumstances that COVID brought on, Lorna managed to get to a state of hopelessness that was unimaginable. Although we recognize Lorna's efforts as those of frontline workers as heroic, it's actually more important to understand that we are all human. Lorna's case is troubling since it highlights the fact that it could be any one of us. And if you or anyone you know ever gets to such a point, there are resources to help. Anonymous hotlines, therapists, psychiatrists who are available to assist, and even by telehealth. We need to know that it's okay to ask for help. Second, how can we maintain our well-being to keep us from getting to that point in the first place? As healthcare professionals who dedicate endless time to always care for others in our practices and our personal lives, we need to prioritize the things that will preserve our well-being. Exercise, healthy eating, sleep, connecting with friends and family, and having fun. This needs to be non-negotiable time, with the understanding that no matter how much good we do in our careers, it cannot be sustained without our own well-being. Lastly, I urge all of you to look at your practices and institutions and think about how we can improve the inadequacies of our current health system, both during the pandemic and beyond. The reality is that practicing medicine in 2020 is challenging from many perspectives. But if we work collaboratively to share the mechanisms by which we can improve efficiencies in workflow with innovation, we can prevent some of the burnout in the first place. And when we think about burnout, it's not only related to long hours and hard work. It has to do sometimes with a toxic work environment and culture that is emotionally draining, something that we all have the ability to influence with collegiality, inspiration, mentoring, and support. We owe it to those who have lost their lives to physician burnout to make this our priority. And finally, I'd like to share with you information about the Dr. Lorna Breen Heroes Fund, established by her family in her loving memory to provide mental health support to healthcare providers. To donate, you can visit www.drlornabreen.com. And please reach out to me if you have any questions. I hope that Lorna's life will always serve as an inspiration and a reminder to all of us of these important lessons. And remember, we can best care for our patients when we also care for ourselves. Thank you, and be safe. For more information on other CVI Heartbites segments, as well as other CVI educational programs, please visit CVI's website and follow them on Twitter.